Dr. D. Van once stated that meet the mind of the patient before meeting the mouth of the patient, thus allowing us to understand the patient's mental attitude and knowing how the patient will respond. Well, there is a family member or yourself, it is very important when it comes to mental health. Almost everybody here has been through something, whether it's a life crisis, mental health issue that has made them potentially depressed, or even in which affected their health. According to NAMI.org, currently depression is the #1 cause to disability worldwide, and major depression by itself is 6.9% of major causes when it comes to health. And when your mental health is affected, your actual physical health is affected, and this kind of creates a circle that never ends. For me, as a certified medical assistant or CMA who works one-on-one with patients who are diagnosed with chronic diseases, I every day get to see patients who go through these life challenges of trying to deal with their diagnosis. And it's very important to understand why their mental attitude affects their treatment and everything else. When a patient feels like their doctor or nurse has a positive outlook, they're more willing to accept treatment, they're more willing to accept help, and they're more willing to accept options. This is why I strongly feel that looking at a patient like a person rather than a disease is very important as a nurse as well as a physician. Especially as somebody that spends one-on-one with their patients, we nurses tend to be the first people they see and the last people that a patient sees, as well as the one that spends the most time with them. Today, I wanted to discuss with you why a patient mental attitude is so important in the nursing field. In order to do that, I must first discuss why a person's mental attitude is so important when it comes to their diagnosis, how it actually affects their health, as well as why it's so important for us nurses to understand a patient's mental attitude when they actually come to us. We hear on the TV about the many types of cancers, the many types of incurable diseases that occur. Leukemia, Alzheimer's, diabetes, are very common diseases that people actually have. These are all diseases that can change somebody's life significantly. So we eat healthy, we try to live our best lifestyle, and we do everything we can to make sure that we are healthy and we're active. And then all of a sudden we're feeling fatigued one day. You go to your doctor, they run self-worth tests, and you start getting frustrated and frustrated and frustrated. This is one of the things that start to lead to depression, because you're not finding out the answer to why you're consistently getting sick. And then all of a sudden your doctor finds the actual answer, and it's something like cancer or it's Alzheimer's, something you wasn't really expecting. Already by that time, you're probably already a little bit depressed and you're already a little bit stressed out because you don't know the answer, and then you find the answer to something that you wasn't expecting. It is during these stressful times when depression can really creep up on a person and can lead to major depression, which is why it's very important for us nurses and physicians to understand and look to see where this actually occurs. For instance, according to Dr. Laura Kavinsky, your outlook, having a sense of optimism and purpose, seems to be predictive of health outcomes and can significantly lower one's risk to diseases like stroke and heart disease. So we see how just turning a frown upside down can make such a big difference. Now I'm going to kind of show you why and how this is very important. Smiling and laughter has been shown to actually improve blood pressure, decrease risk of stroke, as well as decrease risk of heart attack. When people actually smile, it's actually considered contagious, and it's contagious because when people see you smile, they tend to actually want to mimic that smile, and they want to kind of conceive or receive that smile to somebody else. And when we see other people smiling and other good laughter, it creates an atmosphere of good mood that we all kind of like to see and we respond to in a very positive way. This is why it's very important that when a patient comes here, we're happy to see them, we're not ridiculing them, because this automatically kind of creates a good positive vibe for a patient. So now it comes down to why it's important for us nurses to recognize and understand a patient mental attitude. For me, laughter really is one of the best medicines. It creates a better mood, not just for our patients, but also for our coworkers. And it creates an atmosphere that patients are going to actually trust. Because trust is something that can be hard for a patient to build, especially when they're first coming to the clinic. Many patients, especially when seeing a new doctor, have fears of that their doctor is going to treat them more like a diagnosis rather than an actual patient, which is why they look upon our nurses to actually reassure that their doctor is very good, or their pharmacist or physician. One of the doctors I work with, Dr. Corsina, once told me that you cannot treat a patient that does not want to be treated. Sometimes we are too focused on the disease and not the patient overall health. When in return, we should be doing the opposite and making them comfortable enough to want to get help with their disease. We should not be looking at a patient as disease rather than actually looking at them as a person. Something as simple as asking a patient for a drink or something to eat. A drink of water can actually impact the patient health because it makes them feel as if they're a person, not just here for just treatment. According to Becker's Hospital Review, over 77 Americans is actually satisfied with their healthcare, with over 88% of them being happy with their nurses they work with. And that's usually because we tend to focus a lot more on the patient rather than the actual disease. In review. Now that I've showed you why mental attitude is important to our overall health and explain how vital a nurse role is, I would like to finish with this thought. When we are ill, we can waste too much energy being mad or being glad about how people are caring for us, when really we should be out there caring for others. Our illness doesn't make us exempt from reaching out. In fact, I think we are more accountable because we understand the journey better than those who have yet taken it. Just because we are not a good pencil that writes a good story does not mean we cannot be a good eraser that erases other sadness. Thank you, and remember to smile and wave.